It sounds so simple. Configure an ICU so the care team can reach the patient from every angle. But the Theda Clark ICU wasn't always like this.
In our old intensive care unit, we were very much restricted by the size of the rooms and the ability to, at times, deliver life-saving care. This new intensive care unit, which is much more spacious per room, and the ability to have access to the patient pretty much in a 360-degree fashion has been a big improvement for us.
Thanks to community support, the new Theda Clark ICU opened December 2010, just in time to save Matt Paul's life. His snowmobile collided with a car on Christmas Eve, mangling the snowmobile and his body.
I broke my collarbone, fractured C2 in my neck. I guess the vertebrae, I think it's like L1 through 5 in my lower back. Basically all those nubs on the side of your vertebrae, I guess I broke all those off. Ruptured my spleen. My femur, I guess, was sticking out of my leg. Forearm. All my ribs on the left side in multiple spots were broken. Lung was punctured.
Matt's status was so touch and go that night that at one point, the medical team performed emergency surgery right in the ICU.
This new intensive care unit room that we had was pivotal in saving his life, and that was made possible by the Theda Clark Foundation. And if we didn't have their strong support and helping us to have the latest facilities, people like Matt wouldn't survive.
Your generosity also helped Zayden and his mom, Brianne DeHart. Brianne was 27 weeks pregnant when the car she was riding in was hit by another driver.
I just was scared. I didn't know if my baby was going to be okay. Didn't know if I was going to be okay. I mean, they thought I was going to be in the hospital for like 6 months.
Brianne's injuries were so severe, doctors had to deliver Zayden that night. A gifted medical team, the right equipment, and the best possible facilities helped both patients.
It was very, very complex decision making, and it took a number of physicians to come to what would be the best thing for both mom and the baby. And we had our obstetricians, we had our heart surgeons, we had our neurosurgeons, our orthopedic surgeons, and our neonatologists.
Zayden is now 14 months old, and both mom and baby are enjoying life and receiving ongoing care. For 25 years, ThedaStar has been transporting trauma patients and critically ill patients, getting them the medical help they need as fast as possible. Community support and the Theda Clark Medical Center Foundation help keep ThedaStar flying, helping patients when seconds count.
It's one word, it's gratitude for the support of something like this, because what's more important to you when the day is done is your family, your friends, and that they're healthy and have, a chance at, a good life. And so that's what I believe the helicopter and all the resources behind it bring these people.
Your gifts impact more than trauma patients. Thanks to support from the ThedaCare Foundations, the ThedaCare Learning Center for Collaborative Care opened in February 2012.
This is really a dream come true for so many people. Anybody that's in healthcare, anybody that's associated with education. It's really been kind of a culmination of a lot of years of hoping and wishing that we could have something as amazing as this.
The Learning Center is unique in the Fox Valley, and it gives staff the ability to grow and sharpen their skills. It all means even better care for the patient.
It truly is a great opportunity for a new nurse coming in to gain all of these new skills that we're just learning, the technical skills that we need to learn to be competent nurses up on the floor to take care of patients. And you are the people that are really helping us to become the best nurses that we can be and to really make ThedaCare a place that patients and customers want to come.
Trauma care and equipment that turns tragedy into survival and triumph. Facilities and training that help staff members perform at their best. Your generosity makes it all possible.